Hi, Dr. Smita. Thank you for having me here.
Good morning, Meenakshi. I should welcome you first on our podcast. Health Commune, we have just started 2 years back. We keep talking to doctors. We discuss about the diseases and treatment that are available. And I always wanted to see the other side of the story because we hardly ask a person who's living with a particular disease condition what do they expect from doctors community as well as their caregivers. And I don't call it like a inspiring others and other thing, but it's just simply how two friends should talk to each other. How's life going on? That kind of a conversation I wanted to have with you. You are living with Parkinson's, and we are working on Parkinson's with multiple startups, and we are looking at what exactly is the need. Okay. And I think that's the context I searched you on LinkedIn, and thank you so much for being there. So, welcome to the show.
Thank you.
First, let's start with your journey because I want to know, and I want to know what all things. So, when exactly you are living with Parkinson's, when exactly you got to know that there is something that's not, going fine the way you want, what were the first symptoms, where exactly all this started?
Okay, I have to take you a little back to 1997 when I was pedestrian and hit by a car. And after that, I was diagnosed with central pain syndrome, which is now called as complex regional pain syndrome. And in the US, where I was at that time, the drug of choice was morphine and oxycodone, along with Ritalin to help me finish my PhD. And I started working in a place where it was in Florida, and the humidity hit me. And then I realized I do not have a reset button for my being in a place that's so hot and humid. It was too much and it was affecting my work. So I came back to India. In India, morphine is only given to people in end of life stages. So they needed me to go through and it was the worst 21 days of my life going through withdrawal of MS Contin and oxycodone and Ritalin. I came out like feeling like a paper, I couldn't even lift my hands to dress or anything. And I didn't realize for 21 days I'd gone for that. So this was in 2005. And with painkillers, which were locally available, I was working. And I started working with farmers. So I used to go into the hinterland and everything, and I couldn't manage that. So one of the first symptoms that started happening was I started getting very dizzy. People said sunstroke and things like that, but my balance and this thing was not working at all. And suddenly I froze with the pain because the complex regional syndrome had taken over. And in 2009, I decided I'll move to OT and, I'd be fine in the cold. And I was fine. I was only having symptoms of complex regional pain syndrome. Like, I don't know whether you can see, it's all red. So wherever it has affected, it turns red and purple, things going on, because your pulse is between 40 and 140 with whether you're doing something or not doing something. So he said, I'm having Dr. Christopher Matthias from the Queen's Square coming in for a talk. Let's put your journey on and let's see what he says. Because he's written the MSDS, the DSM-4 that had come out for autonomic disorders and movement disorders like Parkinson's. So I said, okay. We met him and he was like, I need her to do a Trodat. I was like, I just took an MRI, doc, a Trodat again. It was like, just take it. And in 2019, let me tell you, the doctor's appointment was around 5. And my mother is like, I will go and get the report. And she gave the report to me, and we opened it up together in the backseat of the car, and it says Parkinson's disease. Do you know how much we laughed and enjoyed ourselves? Because now we know a disease and we can treat it. Because all the while, everyone said either I was faking it with the complex regional syndrome, because I went to labs and they couldn't understand complex regional pain syndrome at that point. It was like, am I imagining it or not? But then with the autonomic tests, it showed clearly, and my doctor was going through that line. And we did the Trodat, it showed us Parkinson's, and he said, you two are the most craziest people I've met who are so thrilled with,
Diagnosis.
having a diagnosis. But so we started on 2019, we started Parkinson's meds. And I was
Right.
told whether I take the meds at a higher dose or a lower dose, in
Yeah.
5 years' time, the medicine will stop working. So I told my doc, I'm still working as an ecologist. I'm still working as an advocacy for chronic pain and other things. I've got too many things going on. So if it is going to work only for 5 years, why not just go with the full swing of it? So we did. And I went to the UN COP28 with it. I was a participant there. I could travel, I could do things, and I was anywhere I went, I would talk about Parkinson's. Okay, and then the biggest honor came in 2024. No, sorry, 2025 Republic Day, when President asked me to come for being the part of the Republic Day celebrations, and it was such a recognition by our president and also by our prime minister. You never think that you will be that close and they will, honor you with that. Last year, from May, June, things started changing. I started having these balance issues. See, in Parkinson's, everyone says balance is there, take a cane and walk. But the balances are very different. It is not like vertigo. It is like your feet go in one direction, you're going in another direction. And with a cane, it is not comfortable. And I'm not a person, or my parents were not a person who are pushed. I live alone. I have a caretaker who cooks for me, but I live alone. And since she doesn't know how to read English or this thing, even if I'm in the worst throes of pain, I have to tell her what to do. Okay, this is a patient's life, because the minute you bring in a regularized caretaker, it is about 25,000 rupees. Forget that. What happens is they are more keen that you stay in bed, so it's easier for them to deal with it. Whether you're in pain, no one is going to tell you get up every morning, whether the pain is there or not, walk. For Parkinson's, movement and exercise is the only thing that's going to help you. Other than that, staying hydrated, at least 2 liters of liquid chai. Actually, coffee is recommended. Drink dark coffee, drink black coffee or cappuccino, whatever. So that keeps the Parkinson's fatigue away. 2 years back, I was told that this is not Parkinson's, this is atypical Parkinson's. All the symptoms fit in with something called as multiple system atrophy, C, which is basically the balance. But my doctor refuses to put me in that category. He said, let's call it atypical. My life has been atypical, so I am now atypical Parkinson's too. And I'm going this time to the World Congress of Parkinson's to talk about being a young onset Parkinson's person in India, as well as a patient who understands what the caregivers are going through and also what the doctors do. And with Parkinson's, all they can do is adjust the dosages as they go. And a lot of ecosystem of doctors are required. You need psychological help. Your caretaker needs psychological help. You have to deal with these things.
But tell me one thing, that your first symptom was to start with the gait related issues that you were facing, for which you reached out to doctor from Chennai. And that time it was diagnosed for Parkinson's.
No, the first symptom was me falling forward and breaking both my ankles.
Oh, okay.
So once that happened and I got out of that, my doctor started doing the autonomic tests.
Mm-hmm.
And then he sent me to an immense with the autonomic tests. And I was told that it is more of a psychological and psychiatric thing, because they couldn't see them. There was no motion problem. I didn't have tremor, I didn't have this thing. So the easiest way to do is call it as something which is psychological that I'm manifesting, and they put me on that. But after the visit of Dr. Christopher Matthias, and we did all the autonomic testing, and I had all the key markers there, then no one could dispute. But
Okay.
another neurologist at that point whom my doctor invited, he said, "This is atypical Parkinson. Stop the levodopa. Stop this thing. Nothing is going to help her." But the thing is, the levodopa is the only thing that's giving me relief in the, you know, for a few hours in a day. After afternoon, I'm not good. But in the morning, whatever I can do, I do.
Tell me one thing, like how's your typical day is now? It's been like 7 years, almost 7, 8 years that you are been
Yes.
diagnosed,
So
and you're living with.
I'm woken up by my caretaker at about 6 in the morning,
Hmm.
and I do 3 kilometers of indoor walking.
Hmm.
Most of the time, I listen to different vibrations. I'm telling you, for each patient, it is different, whether you want to listen to music or whatever. Just think of it and do at least 3 kilometers. You get 5,000 steps in. Okay? You don't have to do it at a very fast pace. You can do it slowly. You can do it however you want. Please use a mobility aid if you are having balance issues. Don't just keep lying down in the bed. Get up and do this. Similarly, there are a lot of exercises for building strength. We need muscle strength because muscles are the first to atrophy and protein is required. So you have to have at least 70 grams of protein in a day. Please talk to a nutritionist and get it done for you. You just cannot, you know, not have protein. And the other thing is not doing any exercise. And
Mhm.
ketosis is the best for Parkinson's, which means going on a ketogenic or a high protein diet. And also, when you're doing exercises, strength exercises with weights, that's the thing that you have to use. So, the thing I would like to tell all Parkinson's patients is don't give up. Please come on to the online forums. Please talk in the online forums. Let's not have your caregiver describe what is your day. You know how it is. I know you lose your will to speak a lot of times because it comes garbled. But don't worry, yeah. People are not there to judge you. Just come
Yeah.
onto those platforms. We
Mhm.
need you there because unless doctors see the kind of things that go, if anyone asks me, there are five cardinal symptoms of Parkinson's. One is the idea of hunching over and walking
Hmm.
slowly, with walking or doing something rigidity. It's called bradykinesia.
Hmm.
I'm sorry for using doctor words, but anyway.
I
Then,
understand.
then you also have this very, very important thing that people will not tell you is this. You start either, you cannot control your impulse. So either you're gambling or you're playing in the share market or you're doing something by, retail therapy, something you're doing which is not you. And that's what the disease takes from you is that you are not you. And that's why I do the makeup because I feel with the makeup, I'm not showing that much of my Parkinson's. As you can see already, the tiredness and droopiness comes in. So for each one, it's a different one. And constipation is one of the other worst things that can happen. We are in India, yaar. Ayurvedic, this thing for constipation are so many things. Okay, you can please get those and have it. And then the fiber, this thing, have it and don't let constipation ruin your life. And for people with young onset Parkinson's, I understand that you're not able to work completely, but let's take the challenge for doing work which can happen in the 4 5 hours that you're okay.
So we were speaking about your typical day. So you take a walk in the morning, and how your
And
days.
then I have a breakfast at around 8 o'clock.
Mm-hmm.
I shower by myself. I have got all the holds and bars in my bathroom, so I don't need help.
Mm-hmm.
But I need to come out of the bathroom, sit on my bed to wear clothes. Clothes is a main issue, especially if they're buttons. Like the
Mm-hmm.
shirt I'm wearing has got buttons, but I
Mm-hmm.
stitch the entire lot up and only keep the first button open so it can come through the head. So you have to look at clothes which help you,
Mm-hmm.
you know, and are practical for you. So that is the thing. Because one more thing is a lot of us are wheelchair users. And
Mm-hmm.
on the wheelchair, no, if you're wearing a short top or something, you have to be very careful as a lady, this thing. And remember when you sit on the wheelchair, your pants go higher up. So these are small things, which you lose, when you go for work or anything. So right now, my mobility, I need to use within the house also, I need to use a walker. I fell yesterday and I fell on the road. So luckily, I just got away with scrapes and this thing. This is one of the biggest things with Parkinson's, the fall. You can't predict it because your gait is very different. Usually in Apple, it'll send out an alarm if it thinks your gait is off. And it has done that for me a couple of times. And, I had to call my emergency contacts to say that I had fallen. But Apple Watch is very expensive, but there are other products out there which are cheaper. Please use them. And Parkinson's pain is real, it's not imagined. If your Parkinson's neurologist is not giving you something for pain, their pain specialists, please go to them. So most of my day from 10 to 12 is on projects that I'm working. I do a lot of grant work, especially for ecology. Starting to do some grant work right now for chronic pain, and I'm a trustee with Chronic Pain India. And this is the purple lanyard that we have done with an NFC card, which we'll come to later, which has all the details of me. I wear it every day. Like Mangal Sutra, I wear it every day because it's not just traveling by flight. Like yesterday, if I had hit my head, they would have been able to do this. So I wear it everywhere. And especially airports, wheelchairs, for one flight is about 10. So you have to have a way about. Luckily, Parkinson's is in the disability arena. If you have got Parkinson's at whatever age, please go to the Department of People with Disabilities, along with your ration card, Aadhaar, and everything, and get yourself a unique disability card. What it does is it gives you a priority for getting a wheelchair, or someone knows something that's happening to you.
Tell me one thing. You're well educated, right? You're PhD, and you travel and you're working. If you look at and despite that, you have gone from hospitals to hospitals for finally arriving at to diagnosis and getting the right treatment, and probably you have contributed a lot to your own health by learning and understanding how the disease works and what treatment is there. Going back, looking at your diagnosis journey, what do you think that what healthcare system could have done differently, which would have helped you to probably get the diagnosis earlier, or probably given you more confidence regarding what's the next step for myself?
In India, most of our doctors are very conservative. They wait to see if it progresses, because the first 2 stages of Parkinson's, you're still able to do things. They might start you off on dopamine agonists, but they won't start you on carbidopa or levodopa immediately unless you're older, because then falls become very, very more. When you're younger, they are like, we know the lifespan of this is 5 years. Whether you're fast or slow, that curve just goes like that. It normalizes and comes down at the end of the 5 years. So don't go doctor shopping. Instead, just go to a neurologist, not a neurosurgeon, and talk to your neurologist about your fears. A lot of us get a lot of anxiety. So ask them to connect you to a psychologist. Now, all this costs money, I agree. But as a responsible Parkinson's person, especially if you're younger and you have to deal with your family, small children, and everything, this is the thing that's going to keep you going. Maybe your hours will be cut from work, but you need mental health. It is very difficult for you to cope. And you need also, like I am right now, my mouth is getting dragged in this thing. You also need speech therapy, and I have to understand speech therapy. And every year you need to get evaluated to see how your gait is, how your movement is, how rigidity is. And you have to get on the UPDRS scale, because that is where we need this thing. Even from smaller towns, please go to a neurologist and see that, or talk to your doctor and say that you think you might have Parkinson's. There's nothing wrong in looking at your symptoms and looking at Google and trying to find a neurologist. Don't put the blame on your caregiver. You take it up.
Tell me one thing, like regarding the diagnosis, going to the right doctor is very, very important part that you explained, which I totally agree. We look at overall India, many of people are not even aware that what's the difference between neurologist and a neurosurgeon, what this doctor will take care and what another doctor can take care. Tell me what else doctors community that you expect from doctors community, whether it is for you or from the community, that Parkinson's patients that you are helping now through the community, or what do you expect from doctors community in terms of treatment, diagnosis, or in terms of communication that would have made living with the Parkinson's would have been easier for you?
So once it is established you have Parkinson's, it's best to be with a neurologist. Okay. And, finding a neurologist is not that easy when you come from small towns like where I am. I had to go to Chennai, which is 500 kilometers away, to get my diagnosis done. I understand cost. I understand this thing. So even if your doctor is a basic MD and he thinks you have Parkinson's, please tell him all that you're suffering from, especially have tightened muscles, when you have difficulty swallowing, when you are and when you are trying to do something, and the worst is the Parkinson's fatigue. Don't fight it. But at the same time, doctor says exercise. You do not need to go to a gym. Everything in the house. You can walk around in the house, put your 5,000 steps to 7,000 steps in a day. You always have Bisleri bottle or something. Fill it with water. You don't need to buy any gym equipment. Fill it with water and lift it up. 2 bottles, you lift it up and do 10 times, do 5 times. But please keep doing it during the day. Do Sudoku, do all these things. And don't let your caregiver tell you that you're sick or you're feeling sick. It has to be you. Because if you depend too much on the caregiver, for the caregiver seeing you in agony like that, they want you to go to bed. But fight, man, fight. This disease has no cure. And how you're going to go through your Parkinson's depends on your attitude.
I think when we were discussing day before yesterday, you said that doctors directly talk to caregivers. Why they should talk to patient? Because they are the one those who can communicate and tell their problem clearly. Tell a little more about that. It was such an important point that you said.
It is a very important point. It's like the doctor examines the patient, but then turns to the caretaker and say, how long has he slept? Or he or she slept. Talk to the patient. Find out how long they've slept. There's no harm in telling your doctor that, like, you do not have sexual urges anymore, or you have constipation. These are not off the board topics. These are topics that you have to talk. And don't let your caretaker decide or determine how you're feeling and what you're doing. You have to tell the doctor, because the doctor has to decide based on what you say and what they see as your this thing, to adjust your medication. The caregiver is there to make sure, because you will forget. You are going to have episodes of forgetting. It's a part of the disease, man. So don't expect to be normal all the time. Every other day is a new normal. So just go with it, and even if you're old, there's no need for, your caregiver to be your answering machine until I think you start losing speech and you can't speak. But there's still, you can write, what you want to. Fight it. Do not give in to it.
Caregivers overall, educating caregivers is something that doesn't exist in our country, right? Like the
They are
moment
doing
patient.
Moment Specialist Parkinson's disease group is doing for they have centers in Bombay, Pune, Delhi, Calcutta, and other places. They've got some 15 centers where they have separate sessions for caregivers and separate sessions for Parkinson's patients. Please find MPD DMS. I think I will send the link. People with movement disorder, if they are near you, try going for us this thing. If they are not near you, what they are saying is you find 4 or 5 people with Parkinson's. If you talk to your doctor, they will tell you who are the people this thing. And you can connect with them, join and make this group so that you are not feeling alone and your caretaker is not feeling alone. Do not belittle a caretaker, because a caretaker has an overall view and they want to do the best for you, but you are your best judge when you talk to your doctor.
Mm-hmm. Superb. Assume that people, those who are listening to us, they are living with Parkinson's and probably their caregiver system is not supportive enough. Okay, could be they are occupied with some other work or responsibilities in life. Not everyone gets that kind of a support. What a caregiver should understand, any caregiver, whether they know that there is a course and I want to take it or they have the willingness to take it, but assume that any person, anyone, what a caregiver should understand, what kind of a support a patient living with Parkinson's require.
See, mostly the support is required in food, adjustment in food. The family has to understand that a person with Parkinson's can eat high protein, which is both for vegetarian and non-vegetarian options. A nutritionist will give you for 1500 calories or 1200 calories day based on your work. So it is an extra work for your caregiver to give you that kind of meal. And it is expensive buying pea protein and things like that. But you have chana dal, you have other dals in the house. So make a mishmash dal of it and have it every day. Have it with rice, roti. And the other thing is having vegetables that grow underground like beetroot, and take supplements like magnesium, which will help. See, a lot of doctors do not like to talk about these nutritional things that you can do. So, talking to a nutritionist helps. And yes, all of this costs money. Carbidopa and levodopa are the cheapest medicines that you can get. But anything to support it costs a lot of money. And I agree, it is very difficult. But every government hospital of the state and the taluk will have a GH. And if you have a GH, it is actually, a lot of people don't go anymore to general hospitals. Actually, you can go there, get yourself first identified as a person with disability and get the card. Meet the neurologist there. They usually, right now in Government of India, they've asked for every office to have physiotherapy. You will get free physiotherapy. Do this. Just because a doctor has got a lot of letters behind their name, go to them, take your medicines, but use these tools like free physiotherapy, free this thing, go
Mm-hmm.
for it. Free
Correct.
medication, go for it.
Yeah. True. Tell me more about the work that you are doing. You have this, you're a trustee of one not-for-profit
Called Chronic
organization.
Pain India. So
Yeah.
we have within it groups of our biggest thing that we did was in 2024 was introducing the pain scale for disability. But actually, this has been told to all the states and everything, but the form for the people with disability still doesn't have the pain scale in it. They're using the old form still. Hopefully, it comes out in the next year. All we can hope when we give our opinions at these forums is that there is some change. There has been change. Parkinson's is identified as one of the 21 disabilities, but there are other people who are in the early stages of autonomic dysfunction or anything. It is not recognized. So you will not get that benefit of having a disability card. Carry something with you, like what I have with this NFC device, something that tells people you have Parkinson's. There's nothing, no harm in admitting that you have Parkinson's. So please do that. And so in Chronic Pain India, we put out a lot of socials every day about different diseases which have pain. And we are here to hear about your pain journey and what you're doing about your pain journey. So contact us. We are at chronicpainindia.com. And if you want this lanyard, which has all the details of your doctors, you can go to the Purple Sunflower Project. I will share the link to both of them. So if you have chronic pain and you have this, please come to us. And in terms of Parkinson's, if you have, there is the Movement Disorder and Parkinson's Society, MSDS at PS, I think. I will give that. Sometimes I find that when you hold keys or something in your hand, that tremor will go down. Easiest is carrying a kerchief like this. See, I've put the kerchief in and I put my hand in. No one knows I've got the fingers have bent and I have to pull them out. No one knows it. It just looks like I'm holding a kerchief. There are a lot of things, and if you've got the basic variety of Parkinson's, you can go for deep brain stimulation at NIMHANS, which will be at a very low cost. You've got the different pumps that are available now. They're all available in India. And you have got beautiful support wheelchairs, canes, or whatever you need. Don't look at it as something as an aid. I look at it as a fashion accessory. I decorate my cane. I decorate my listing. So it's a part of me. You have to take it that way. This is all a part of you, and it's not going to go away. Parkinson's will not disappear. All we can do is slow down the progression.
My goodness. I have one last question for you. Okay, because I want to keep it short, and you have already given so much of time and explained almost everything. I think more than this is like one-to-one consultation with you for per patient basis. That should work. What keeps you motivated? I am so inspired to talk to you, and the way you deal with everything and the way you are helping others. What keeps you motivated? What inspires you to do whatever you are doing?
One thing is gratitude. Before I brush my teeth, I talk to the mirror and tell every day that you are enough, you are okay. Today may not be a great day, but there's always tomorrow. I'm always looking for that glimmer of tomorrow. Don't spend your time thinking of your present. Think of tomorrow. Push yourself for tomorrow. If today is not a good day, tomorrow will be.
Wow. Oh my goodness, that's so beautiful. Perfect. I want you to do lots of good work, take a walk, have a good diet, and consider Health Commune as your team now. All my team will be very happy to support you for all the work that you do. We get motivated by helping people who require information.
Yeah, I think talking to patients is an art that most of the doctors have a problem with because it's a time-sensitive appointment. So they decide to go through the test. They don't tell you anything more than saying, "हाँ, ये Parkinson's है, ये खा लो." हाँ, but they don't understand your anxiety. Your anxiety just goes high. And I'm saying, please look in the internet, not for क्या क्या होने वाला है Parkinson's से. Look for support groups. We are there on Facebook. We are there everywhere. Come to us, and we will help you.
I agree because for every, not just Parkinson's, for every condition, you need a support group, and those who are going through the same will be able to support you more. For every, they'll be able to understand you better. It's like a like-minded people. And if you have even one friend, it makes a difference. And if you have a community, think about the positive impact that it can build for yourself.
And you can all meet together in a park or something and do sitting exercises together and talk about, maybe bring your protein snack and look at what other people are having as a protein snack. See, these are things that you can do. And be proactive, and let your caregiver also go for these sessions so that, the caregiver is overwhelmed. They don't want to tell you anything more. So they are taking things in a different angle. And there are people around for you. Don't use Facebook as your guiding light. You'll find enough community. This is not some secret that some NGO has to have.
Yes.
This is all that is there on the internet. There is a lot of things happening. And there are a lot of people putting out good material on Facebook, on Reels, how they deal with exercise, how they deal with a bad day. So don't be upset. This is also part of life. Take it as part of life and keep moving and keep doing things. You do not, I understand you have depression, but you have to find the will to get up and brush your teeth.
Yeah. Are you on Instagram? Are you creating content?
Yeah, I'm both on Facebook and Instagram. So I'll give you those links too. So
Yes, I'm going
I
to follow
try
you.
doing these videos about my life because it is interesting. And thank you, Dr. Smita, for having me here.
Yes, thank you so much. And let's stay connected. Please just consider us as your team now.
Yes, I will do that. Thank you so much.
Thank you.